Good morning, Mr. and friends. Today, my group, Celine, Annabelle, Naila, Astrid, and Samuel, will be presenting about population policy in Niger.
Population structure and density of Niger. As of 2022, more than 20 million people live in Niger. As seen from the population pyramid, Niger has a high birth rate. As of 2020, Niger has a birth rate of 6.89 births per woman. Said country has a population density of 19 per kilometer squared. Based on Lord Adair Turner, it is possible for Niger's population to reach 50 million in 2050.
More than 4 million households in Niger are facing the devastating effects of food security due to the failed precipitation and the increase of desertification of the Sahel, the border zone in Africa between the Sahara to the north and the more fertile areas to the south called Sudan. Niger is currently affected by the worst food security crisis of the decade, with 4.4 million people in need of immediate help. The current crisis is the continued decay of the food security in the Sahel region, where it irritates the socio-economy of the population. This contains the list of threats that affects the people of Niger. They tend to not have enough good access to sufficient food supplies and are exposed to many hazardous threats affecting their well-being, such as natural hazards like climate, droughts, and wildfires, epidemics, malaria, meningitis, and cholera, and lastly, insecurity, leading to migration and competition over resources.
Due to overpopulation, Niger is struggling to provide young people with the needed education, which will lead to an increasing unemployment rate in the country. With the population rate being higher than the number of resources Niger has, society struggles to access good health care, malnutrition, and food insecurity. Food insecurity causes a high crime rate, poverty, famine, and high birth rate.
Niger has a population of about 26.7 million. With their economic being below average, Niger has been the least developed country in the world. Their poverty causes an impact, which are less people having less nutrition to take, unsafe neighborhoods, and so on. One of Niger's deadliest diseases are malaria. Over 50% of deaths from Niger have been caused by malaria. Since Niger is a less developed country, some medicines or pills are unreachable or unavailable to cure them.
Lack of education. According to Borgen Project, more than 50% of children between the age of 7 and 16 do not attend school. The country Niger has been fighting a war against poverty for many years. Schooling in Niger is compulsory. Many areas in Niger do not have educational facilities. Most students in Niger live far away from school and do not have enough money to purchase car or motorcycle, even to pay public transportation to school.
The government of Niger has taken some action in regards to this problem, but most of their action are in collaboration with the World Bank. In 2014, Niger adopted the institutional framework to promote fertility reduction. They adhered to the international conventions to abolish child marriage. They also removed the mandatory authorization from parents or husband for married adults and girls to access family planning. They have also created a child protection committees that have been institutionalized to promote, safeguard, and fulfill the right of girls and protect them from child marriage. The UNFPA, or the United Nations Population Fund, has also taken some action in regards to this problem. They have created a program called Life Skill Program for Girls, where marginalized girls will reach with health, social, and economic asset building programs. And also girls receive with support from UNFPA prevention, protection services, and or care related to child, early, and forced marriages. The UNFPA also did some other programs which include community declaration on harmful practices such as child, early, and forced marriages or female genital mutilation.
That is all for our presentation today. Thank you.